Good morning, and thank you for coming out today. We're really appreciative. As we were setting up today, we realized that almost 1 year ago today, we were opening our emergency department BHU unit, our behavioral health unit. So how fabulous. Thank you. Really fabulous to be here and wall breaking on our new unit. Before I get started, I did want to introduce our executive leadership team and ask them to stand up. Ron Langlotz, our Chief Nursing Officer, Dr. Jeanette Nazarian, our Chief Medical Officer, Claro Piorito, our Chief Finance Officer, Teresa Forget, our Chief Human Resources Officer, and Ryan Brown, our Chief Operations Officer. And the entire executive team has had a lot to do with this, but special kudos to Ryan Brown and his team. Before handing it over to Dr. Ahmed, I want to thank our elected officials at RSVP to come today. We have County Executive Dr. Calvin Ball, Senator Guy Gazzone, Delegate Chow Wu, Delegate Jessica Feldmark, Delegate Pam Gazzone, Delegate Jen Terrassa, Jessica Clapman from Senator Van Hollen's office, Councilwoman Christina Rigby, Councilwoman Deborah Young, Councilman David Youngin, Councilwoman Liz Walsh, Councilwoman Natalie Zingler. And if I forgot anybody, thank you for coming. We appreciate having all of you here today. I'm going to hand it over to Dr. Ahmed to get us started.
Great. Well, thank you very much, Kirsten, and welcome and thank you everyone for being here today. This is a very special day for us. This morning is many years in the making. It's the result of Johns Hopkins Howard County Medical Center's partnership with county and state officials, including Dr. Ball and the state of Maryland, championed by our very own Senator Guy Gazzone, as well as a very significant donation from Greg Collard from the Collard Foundation. So thank you very much to all of you for helping to make this happen. The opening of this new 29-bed observation unit will have a direct and positive impact on our hospital capacity. Like our counterparts across the country and across the state, we've experienced challenges concerning long-term boarding for patients who are waiting for disposition from the emergency department, which ultimately impacts all patients, but most directly with wait times in the emergency department. This is a national trend, unfortunately. It's rooted in many causes, which includes constrained capacity in behavioral health, skilled nursing facilities outside of the hospital, and a lack of sufficient primary care. The complexity of this issue is requires an ongoing partnership between healthcare leaders, county, state officials. There are no simple solutions, but today is an important step in the right direction. This new unit marks the first time that Howard County Medical Center has added a significant number of incremental beds since 2009. Our hospital is consistently full, reflecting a growing county, 92% occupancy last year. While we feel that this will add improvement to throughput in the hospital, we will feel it most in our emergency department. When we do not have open hospital beds to move our ED patients, it does lead to longer wait times. We take our responsibility to the community very seriously. Our job is to be ready to care for you every moment, every day, 365, 24/7. Our new unit, located on the first floor of our hospital pavilion, will help us to keep that promise to our community. It also offers us versatility with the ability to serve different functions if we were to ever see another pandemic or public health emergency. We anticipate that this new unit will open in the fall of 2026, early winter, ahead of the respiratory virus season, when we tend to see a larger influx of our patients. I really do want to thank everybody that's really helped to make this come together. A special thanks to Kirsten Bayer for helping in the foundation. A special thanks to Ryan Brown, our VP of Operations, for his facilities work to get this going. And really all of my executive leadership team that you were introduced to earlier, they've been tirelessly working to make this come to fruition. So thank you very much. I just want to hear another round of applause for all those folks. It's for all of Howard County that we're gathered here today. So thank you again. And with that, I'd like to introduce Dr. Calvin Ball.
Good morning, everyone. Today is a momentous occasion. It's a day that represents not just bricks and beams, but hope and healing. The magic of this moment would not be possible without the partnership of Dr. Shafiq Ahmed. Please give him another big round of applause. He and his entire team here at the Johns Hopkins Howard County Medical Center have worked tirelessly to make today a reality. For far too long, communities across our nation, even right here in the great state of Maryland, have faced overburdened emergency departments and limited access to timely care. In 2012, just 5% of adults said that they went to the ER because they couldn't get a timely appointment elsewhere. Today, that number has climbed to approximately 18%, representing nearly 1 in 5 adults. We know that that means longer waits, fuller hospitals, and greater strain on our hardworking providers. While Howard County is home to 3 major medical systems, Johns Hopkins, MedStar, and the University of Maryland, we have only 1 hospital. This medical center, our hospital, our lifeline. And yet this hospital, as Dr. Ahmed noted, has not expanded its bed capacity since 2009, even as our population has grown and our needs have become even more complex. Since becoming your Howard County executive in December of 2018, my team and I have made healthcare access and equity one of our highest priorities. Together, we've invested in facilities, but also in people, in systems and solutions that will help ease the strain and strengthen care. We now fund behavioral health navigators to connect residents with treatment and reduce unnecessary ER visits. We now fund support for high utilizers at this hospital, and thanks to that investment, Johns Hopkins Howard County Medical Center now has the 2nd lowest multi-visit rate in Maryland at just 17% of patients. We now fund maternal health supports, helping over 200 mothers and families avoid emergency care and receive the support that they deserve. With MHA and our hospital, we launched a discharge hospitality suite serving nearly 10,000 patients and saving approximately 174,000 minutes or nearly 3,000 hours of hospital time. And this past December, we celebrated the opening of the new behavioral health unit, tripling bed capacity and reducing wait times, thanks in part to $2 million of Howard County support. But even with all that progress, we knew that we needed to do more. When we made that $15 million commitment to build this 29-bed observation unit in October of 2023, it was also about building capacity for compassion. Because every bed represents a person waiting for answers, a child in need of care, or an older adult hoping for relief and comfort. We knew we had to transform these obstacles into opportunities, and as we prepare to stand here, soon with our hard hats and hammers, this wall breaking represents us breaking down barriers to access, breaking through delays in care, breaking open new opportunities for health, new opportunities for healing. This project is a commitment to every patient, every nurse, every doctor, every family who calls Howard County home, that we will continue to treat with compassion and lead with love. It's proof that when we put people first, there is no wall that can divide us. Instead, they become the foundation for something bigger, something better. Together, we're breaking walls and building hope. Together, we are helping to ensure that everyone in Howard County can live healthier, happier lives. Thank you.
Thank you, Dr. Ball. We appreciate it. Next, I'd like to introduce Senator Gazone.
Good morning, everyone. This is a big day. This is a big deal. People have been talking about wait times for a long time, and we're doing something about it. We collectively are doing something about it. I am very pleased to be partnered with the hospital, county executive, county government, state government. Some of my good friends from the legislature are here, the nonprofit community and the foundation community. Thank you. So I'm the chair of the Senate Budget Committee, which is kind of a cool job. And then people start asking for things. I get dozens upon dozens upon dozens of requests from hospitals all across the state every year for funding for all kinds of projects. And a couple years ago, I finally came to the conclusion that I certainly didn't have the insight or knowledge about what was most important at any given time, and that we had to up our funding through the Hospital Association program and have the professionals come up with what was best. And this project was decided upon at a little over $700,000 were put in this project from the state. I think I'm just grateful that we are in a position to do this, because it is a big deal. It is Dr. Ball, who is very eloquent, said it multiple times in his remarks. This is a moment that we needed. This is the moment that we stepped up to together, and I'm just grateful that the state, my colleagues here, were all able to be part of that. So thank you all very much.
Thank you, Senator Guzzo. Next, I'd like to introduce Greg Collert, but before doing so, I just want to say a couple words. When we first started talking to Ellen Myers and Greg from the Collert Foundation about the project, one of the things that Greg said to me is, I believe Howard is a very giving community and they will all come together. And so he challenged us. He challenged us with a $600,000 match that we reached, I'm happy to say, by October. It was October just last month. And so I really want to thank him. I want to thank him for believing in us. And I want to thank him for providing that challenge, and for the Collert Foundation for their generosity to the hospital.
Thank you, Kirsten. That was part of my speech I was about to give, too. And thanks to everybody for being here today. But before I get started, I just wanted to make a comment in that the hospital has a fundraiser tomorrow. It's a pickleball tournament, which Dr. Ahmed is playing in, and I'm playing in. And I was going to issue a challenge, but as it turns out, we're in different divisions. So he's in a higher division than I am. So best of luck with the fundraiser and your play tomorrow. So I had two messages that I would like to share with you today. And number one is, why does the Collert Foundation support the expansion of our hospital? And that's easy. There are numerous reasons, several of which have already been mentioned. I see priority number one is the reduced ED waiting times. Also, this is the only hospital in the county, and we need it to be the very best. And for the Collert Foundation, healthcare is a priority. It's our number one focus area. We give more money for healthcare than any other area. And as Dr. Ball mentioned, it impacts all of us in the county. And just lastly, I've lived here most of my life, and I want to give back to the county that I grew up in and our kids grew up in. And the second message today is to request and encourage community support for this significant expansion. As Kirsten mentioned, we did a $600,000 challenge grant. It's something we like to do. as it helps donors. It, in effect, doubles their impact. If they give 5,000, the net result or the equivalent of 10,000. If they give 50,000, it's equivalent of 100,000. So it's a very big deal. And I wanted to give congratulations and a big shout out to Kirsten and her team for this major accomplishment. So good job, Kirsten. But that's not the end. It is our hope and vision that the community continues to come together to understand and support quality health care in the county. This is an investment in the current and future health of Howard County. Thank you.
Thank you again for everyone for coming out today. At this portion of the program, this is ending. We have invited several people over to do a picture of the actual wall breaking. It is in a construction zone, so unfortunately we can't bring the whole group over, but we want to thank you for coming. We'll continue to keep you posted as we move forward, and thank you for supporting our hospital. We're certainly appreciative. Have a great afternoon.
Break a wall.